Hey, everybody. Happy New Year. We are on chapter 11 of Injury Illustrated. This is the story of the infamous bottle of pus that I created that has come up. I've been questioned about on a couple podcasts and is an excellent um, lesson in knowing your measurements and knowing how big things are in cases. Um, I talk about always having a ruler so you know how big incisions are and surgical devices and hardware and these sorts of things, like really knowing what things are. So, anyway, I'm going to read this paragraph to you. And you really need to read the entire chapter to understand what's going on in the entire case. But this is the part about the physical exhibit. While the attorney and myself discussed the upcoming deposition of the treating physician on the plaintiff side, we considered the purulent fluid expressed in the emergency room. The pus floating freely in the abdomen was evidence she had a perforation in her stomach and a resulting tissue necrosis and infection. She never should have been discharged with a fever. How many nurses missed her rising temperature? More intriguing to me, how much was 3,000 cc's of purulent fluid? I asked the attorney if he knew offhand how much that would be in layman's terms. After some quick math and a Google search, we discovered that 3,000 cc's were the equivalent of 3 liters. I immediately walked over to the convenience store and bought a 3 liter bottle of pop or soda, whichever you prefer. I emptied the bottle and removed the Coca-Cola label. I sat back to consider the texture of pus and started a grocery list. The next day, I filled the bottle with mostly shampoo, applesauce, some coffee creamer, and a touch of chocolate syrup. I tinkered with the consistency and color. Satisfied with my fake purulent fluid, I labeled the plastic bottle 3,000 cc's and presented it to the attorney. He laughed out loud and hugged me. Brilliant, he exclaimed. This is the bottle of fake pus. Um, the deposition of the treating physician was videotaped. The anatomical illustrations were printed. Dr. Jackson was given a Sharpie marker and was asked to mark on the images as he described what he had witnessed in the emergency room and in the following weeks and months of Kim's repair procedures. The marked illustrations were added as exhibits to the deposition. The attorney asked specifically about the fever. What temperature is enough to consider trouble and delay the patient's discharge? He asked what evidence we had that Kim had a massive ongoing infection when she was discharged by Dr. Adams. The look on Dr. Jackson's face when the bottle of fake infected pus was set in front of him was unforgettable. His eyes were big as saucers, with an obvious glint of joy. He was asked if the bottle was a fair and accurate representation of the purulent fluid he noted in his operation report. He exclaimed, "Yes!" And with a tilt of his head in consideration, although it was a bit more yellow. Chapter 11.